Good morning, everyone. I'd like to call the meeting to order. We're going to take a couple of items out of order this morning while Jenny Fishman arrives. So I'd like to move on to the review and discuss the coronavirus COVID-19 update. And we have Solo Dennis and Amelia Houghton available to discuss have any comments in this regard?
Yes, good morning.
Good morning.
In terms of the coronavirus update, we are still reminding those that have pre-existing health conditions to be mindful of large gatherings. We are still reminding residents to get vaccinated if they haven't gotten the vaccination. And we are still monitoring the entire process. And I'll ask my colleague, Ms. Amelia, Chief of the Nursing, to add and provide all of the nursing updates as well as possible.
Hi, good morning. So we held a COVID clinic at the fire station this month, and we vaccinated 14 people. One of those patients received a vaccine for the first time. She was a child. So we have scheduled a follow-up clinic in March, and I think that's March 10th, where that child can get her second primary series dose. And we also organize the clinic so that there are 36 slots for registration, and you have to register, and it's a link that Carrie has put out to various sources and outlets. So far, we have at least 12 that are signed up, which is a good response. And we're holding these last few clinics while the state is having their gift card incentive so that our towns can take advantage of the opportunity. And there isn't great need in Shrewsbury to receive a vaccine right now, but there is enough that it's worth it to keep these clinics going. So since January 1st, I can tell you that PCR confirmed cases that we see through the virtual network that we're a part of, Maven, up to today, January 1st to today, we've had just under 200 cases confirmed. So the numbers are still there. And that's basically it for COVID.
Okay, thank you, Amelia. Are there any further comments from Dr. Abraham or?
No, I think I echo everything that's been said. There's still community prevalence. The wastewater surveillance data seems to reflect that it's definitely not gone down to any significant levels in the community. Hospitalizations are significantly lower, so indicating that the burden of or the severity of disease is much milder. People, I think, have more access to medications such as Paxlovid and other antiviral agents, which can help blunt the effect of the illness quickly. And so we don't see too many people coming in with severe illness. That's a good sign. Our flu numbers are relatively low for the season. For this February, usually by end of March, we see the end of flu for the large part. And there are sporadic cases in April, and RSV has pretty much died down significantly, so that's a good sign at least. So Mpox, which used to be called monkeypox before, and RSV are two successes at least in terms of waning numbers. So that's cause for optimism, and hopefully COVID will settle a bit more once the cold weather abates. But for now, otherwise everything that's been shared, I echo.
Okay, thank you, Dr. Abraham. Are there any other questions for
I'd be curious as to the impact of long COVID.
We still see sporadic cases of varying organ system involvement. It's fascinating to see everything from heart-related illnesses to muscle-related illnesses. We recently had a patient who had extreme muscle weakness, which was breakdown of muscle, which was attributed to COVID. So some exceptionally rare and some not so rare complications. So I think there's much more sensitization to the fact that this may be post-COVID, and so COVID-associated illnesses, and so there's a lot more recognition now. I think the jury is still out as to how much is definitively COVID-related and to what extent these illnesses will persist, especially with the XBB variant, which is the current prevalent variant in the country as well as locally. So I think that more to follow. It's still premature.
Okay,
Thank you.
thank you. If there are no other questions, I'll move on to the next item, which will be the review and approval of the minutes from the January 20th, 2023 Board of Health meeting. Do I have a motion to approve the minutes?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item is review and act on burial agent designation for burial permits. Could you quickly summarize that one, Carrie?
Sure. So the current process is that I, from the health department, have to complete a spreadsheet which is sent to the state to basically designate the town clerk or their constituents in the office as a burial agent. So they already use an online burial permitting system. So if the board is agreeable, we could send a letter to the state from the Board of Health just basically saying that we're allowing permission for the town clerk to act as an agent on our behalf. Basically, just takes me out of having to complete the spreadsheet. It would still have to be completed, but the town clerk would have more flexibility on, as people change in the office, there's been a little bit of turnover, and as their roles change in the state database for burial permits, they can fill out the form on the fly and just send it in themselves.
Okay,
So it basically streamlines the current process a little bit more. But it's totally up to the board.
okay, are there any comments or questions from the board?
No.
Motion to approve the town clerk as our agent for the Board of Health for Shrewsbury for designation for burial permits.
Okay,
I'll second.
okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. So it's approved to send the letter to the state. Okay, we've already done the coronavirus COVID-19 update, so let's move on to review and discuss updates from the Central Mass Regional Public Health Alliance. Do you have any comments from you, Micah, or?
Sure. We did have one foodborne illness complaint. A family started feeling ill like only a half hour after eating at a restaurant. I did go inspect the restaurant and didn't find anything suspicious or anything like that. No one else has called in and reported any of their illnesses from there, so it seems to be an isolated thing, and they had norovirus-like symptoms, so it could have been something along those lines. I know it's popping up right now, so we'll keep our eyes out for that, especially if it happens at a restaurant. We'll definitely take a good look at it. But other than that, it's been fairly routine, sort of a calm month. So if anybody has any questions for me, I'd be happy to answer.
Yeah, I was going to ask about the norovirus. The prevalence is 15% across the country, so there is definitely norovirus. We see patients reporting the typical GI illnesses with both vomiting and diarrhea. And so I'm curious whether schools or other eating establishments, if that's been an issue, or should we sensitize people to report so that you're aware if there is such, because it's a very infectious illness in the sense it spreads rapidly. Multiple family members in the home, et cetera, can quickly get infected.
We do have it currently at the long-term care facility, rehab facility. But I think the state has already been involved in Amelia as well, so.
Great.
Yep.
So any cases that I reported, there's something that's dealt with or recorded?
Yes, absolutely.
Okay, great. There,
Can I just say something?
sure.
If a long-term care facility informs us that they have residents that are affected by certain symptoms and the state works with them on what to do next, instructions, cleanup, a game plan, we still get involved because if they're tested, they become Maven, and we still participate in the contact investigation, whether we discuss with the patient themselves or the clinical directors there, we still complete all the cases. So we're always involved.
Okay, thank you.
So recently read an article in the Telegram about a new drug that is hitting the streets, that it's not responsive to Narcan. I don't know if anybody else has any information about that.
Not at the moment,
No?
no.
Okay, well, it was regarding Worcester, so I was curious.
I can definitely look into that and I can report back this evening because we do have our substance misuse program in the city.
That'd be great.
Thank you. Welcome.
I think I also read that there is a move somewhere to possibly make Narcan available over the counter instead of by prescription. Is that something that's happening?
The FDA's advisory panel has recommended that.
Okay. Well, if there's nothing else, then we'll move on to the next item, which is to review our meeting schedule.
Is March 17th an option? I have to give a lecture at UMass at March 24th.
Yes, it is, for me anyway.
March 17th?
Oh, St. Patty's Day.
Patrick's Day.
Oh,
We'll wear our green.
yes, that works.
Okay. So let's make it for 8 a.m., March 17th, for our next meeting. Okay, if there are no other questions or comments, do I have a motion to adjourn?
So moved?
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting is now adjourned. Thank you, everyone. Thank you, Solo and Amelia.
Thank you.
Thank you, guys.
Thank you.
Thank you.
Thank you.